I've spoken about this before, but FHIR isn't just a data structure. It deals with the framework and the technology integration around it, which makes it easy for everyone to get involved. It's open source, it's available. So realistically speaking, if everyone's dealing with that, then everyone can transfer that information. And I think having that information available, not just to be able to send to different providers, but to the patient themselves, I think is super important. We've seen a large uptick in vendors taking efforts to allow for patients to access their data insofar as they have it on their records. And so having FHIR allows them to ingest other data that may be coming from external sources to increase the breadth of what Daniel mentioned before, that longitudinal patient record.
Yeah, I just want to kind of touch upon one of Khan's points with regards to past attempts to achieve healthcare interoperability. So obviously there have been past attempts, but I feel now there's a confluence of factors that makes FHIR so special. So for example, one, as Khan mentioned, it does leverage modern web protocols. It does leverage modern technology that other industries are using. But I feel also the nature of healthcare interoperability is that because there are so many variables. So for example, the financial industry has achieved a modicum of interoperability for a while now, but for health interoperability, you're dealing with multiple factors, you're dealing with multiple variables and multiple values. And one of the interesting things about the FHIR standard is that because of its open standard nature, you have a lot of individuals and organizations contributing to the growth of that standard. So for example, with the initial versions of the FHIR standard, you had DSTU1, DSTU2, and it slowly started going towards a normative standard, which it achieved with R4. And now we see with R5 and R6, you see many more organizations are their expertise and their voices to that standard itself. And on the topic of patient engagement as well, the HL7 International Organization is also very keen to get that patient voice in. For example, we have many working groups, and one of the working groups we actually have is something called the Patient Empowerment Working Group to take into account the perspective of the patient with regards to the data they'll be receiving.